Hi there, this is Justine Calderwood with the Healing Spot Physical Therapy, and I was just wanting to talk a little bit today about falls and their impact on your body, specifically the low back and the pelvis, because as we come into the winter months and the popular winter sports like skiing and snowboarding and ice skating and hockey and things like that, I talk to people and treat people that have had falls, maybe even just slip down the steps, bump, hit through their bottom. Maybe slipping on the ice. It might be even a misstep, like off of a curb, or that quick motion where you thought you were down but you weren't. And then also, recently, if you've been following any of my stuff, back in the summer, I actually did some cliff jumping a couple times and landed on my feet in the water, but it had such an impact through my legs that I ended up injuring my coccyx. So if you have any of the symptoms that I'm going to go over, you might just consider that there may be an imbalance in the bony structure of your body, and you might want to get it looked at because it is treatable. When I do education on the back and the pelvis, so I'm going to just kind of go back just a little bit. Here's a little spine model, so it shows, looking at it from the front, you can see your spine stacked up. Of course the head would be up here, okay, but I just have a little part of the head. And then you have the pelvis down here making the ring, and then you have the legs coming down, okay? So what this is basically just this tiny little pelvic part, okay? When I look at the pelvis, we really look at it like as a right half and a left half. They meet in the front. This right half and the left half meet in the front at the pubic bone, and then in the back at the sacrum or the tailbone, and it kind of sandwiches that, okay? And I'm just going to open this up so you can see that, there's mobility through these joints, okay? So depending on where you've fallen, you may not be lined up. This is something I look at when people come in. I look at, okay, what's the alignment? I take a step back and I look at that posture. Where is the body being pulled out of alignment? Where is it pulling? Where is the soft tissue pulling this bony structure out of alignment? What are we going to do about it? So what can happen if we look at the right half and the left half, that you can get 3 degrees of motion, basically. So one side may be up or down. We call that an up slip or a down slip. Okay, so it's not going to meet level here in the front, and it's also not going to be level in the back. There might be a rotation, so we look at this kind of like a wheel, okay, and there may be a twist like this, and it's either an anterior going forward or a posterior rotation going backward. Okay, and the other thing that can happen is an in-flare or out-flare. So if we look at the front, it may be open in the front and out-flare, or it may be closed down, okay? So you can imagine if this is open in the front and it's pulling on that pubic bone, this pubic symphysis, it's also compressing, squeezing in the backside, okay? Or vice versa. If it's open here in the front, it's actually compressing more through that pubic bone. So these are the things that I look at, and most of the time, really, honestly, they're all 3 affected, okay? The beauty about what I do is that we're really using that wisdom of the body to kind of bring balance back, because your body knows exactly where it needs to go. I just provide that little bit of nudge that it needs to get there, okay? So some of the symptoms that you may be experiencing to warrant getting this looked at a little bit further and seeing a physical therapist for your pain would be like just general low back pain, okay? It might be SI joint pain, so you're looking at this from the back, you're looking at the sacrum, where you really get, not really in the butt, but higher up, that kind of dimple area. I get people that say, gosh, it just really hurts there. It's very pinpoint. It might be pain in the buttock, stemming from some of the irritation of the sciatic nerve. So pain deep in the buttock almost feels like a hot poker in there. There can be things like coccyx pain, so clear down here, the very tip of the tailbone, and that would be, a little lower, kind of like right between your butt cheeks or in your butt crack. That's your coccyx. You might have pain there. So there might be pain, say, with sitting, transitioning, such as sit to stand, getting in and out of bed, getting in and out of your car, okay, where you're kind of having to do that twist, standing on one leg, where you're standing, at the grocery store and you shift your weight to one side and you're like, man, that really hurts, or standing on one leg to have to put, your pant leg on. There may be pain with sex. There may be pain with, like a vaginal exam. You may even notice pain, like headaches, okay? And you might not even realize, I have talked to a lot of people about headaches and how it can actually be stemming from this imbalance. Because if we go back to look at this, this pelvis, I really look at it as being the foundation of your whole spine and your head. Because if this is off, guess what? Your body is very intelligent. It's going to compensate for that, because say you're off, you're not going to be walking around with your head like this or all cockeyed, because our body knows we're supposed to have our eyes horizontal. So it will make adjustments between here and there And a lot of times that's that strain pattern, we start getting pain with that, okay? So even with headaches, I look at this all the time. So what can be done about this? So when someone comes in, I already said, this is the first thing I look at is how the body is setting, what's going on, so I can start bringing balance back to this. And I look at that bony structure. I'm looking at the soft tissue, the fascia, that soft connective tissue, and what it's doing to the bony structure, but also through the muscles. That's what we start with, is looking and feeling, checking mobility, and using all that information that I know as a physical therapist. And then for treatment, it's very gentle. People are often surprised. I've had even people say, gosh, it doesn't even feel like you're doing much of anything, but there can be a lot going on underneath my hands that people aren't aware of, and it doesn't take a lot of force to get the body to change. I do a very, very gentle approach. What I do is have somebody lie down, and I would look at, where these things are lined up. I look at the standing as well, but it's a very gentle, like I said, nudge. So if somebody has a rotation, it might look like this, where I'm very gently rotating them back, okay? It might look like, if they have an upslip or one side is completely shifted up, I may be pulling very gently down through the leg, okay, to decompress that. Or I might be opening up the muscles and the fascia in through the front of the trunk and into the back, okay, and that might be done sideline, or it might be done lying down. With this in-flare, out-flare, it might be even just gently placing my hands on the bones from the front here and very gently opening up, or seeing what the body needs to do. I do a lot of listening with my hands and just accommodating and following where the body wants to go. The other thing that I do is come underneath. So, if somebody's on their back, again, come underneath and take a hold of this sacrum here. Put my lower hand on the lower abdomen, so I'm working through the body this way, and through this pelvis, because, think of all the abdominal organs and structures that are in through here. And I'm very gently with this bottom hand, very gently pulling down and waiting for the body to give and following that where it wants to go. And that does a really good job of decompressing the sacrum from the low back and opening up. So it's very, very gentle. I do what I can externally, but sometimes depending on where the pain is and what's going on, it may be necessary to address this coccyx, okay? So if you've had a fall directly on that tailbone and it pushes that forward and pushes that coccyx into this pelvic inlet, it's going to affect quite a bit of things, like, going to the bathroom, like having a bowel movement, sexual activity. It could even affect childbirth, your ability to actually have a child vaginally. Okay, so mamas, listen up, all right? Especially if you're pregnant right now and you've had, even years ago, if you've had a fall, make sure you get this checked out, okay? I do this for pregnant mamas as well. But anyway, going back, it may be necessary to do an internal exam as well. And what that means is just basically doing a digital exam using my finger and checking this from the inside. So for women, I'm just going to change models here, but looking at this, we can go through the vaginal opening, and if you can see in here, I can get into I'm just going to take this off. So we go in through with the finger and into the pelvic floor muscles, and then we can check to see where that coccyx is, if it's shifted off to one side or the other, and we very gently push down on it and allow the body again to go where it needs to. For men, to do an internal assessment and treatment, we go through the rectum, okay? So that's done, usually I do it sideline, go through the rectum, and again, I can assess and treat where that coccyx is, okay? Going back to the headache thing, all of this spinal tissue is covered with what's called the dural tube, and if that coccyx is shifted into the pelvic inlet, it's going to pull on the end of that is the head, okay? So shifts down clear into the pelvis can be causing migraines and headaches and such, and I've helped quite a few people relieve their head pain by actually taking a close look at the pelvis. So that's in a nutshell what I wanted to cover today. I do appreciate you being here. If you have questions, please leave them below. I'm happy to share my knowledge and answer any questions to the best of my ability as a pelvic physical therapist, as somebody that specializes in treating chronic pain and looking at the body as a whole. If you are interested in getting a little bit of help and you're local to Woodland Park, please go to my website at healingspotpt.com. You can either schedule a phone consultation with me. I'd be happy to talk to you on the phone, or you can schedule a discovery session. We can sit down in person. We can go over this a little bit more detail. Otherwise, if you know too, hey, I just want to get started, I want to feel better, it sounds like what I need, book an appointment. I would be happy to see you. So All right, thanks for tuning in.